Hello, I'm Dr.L.Ravishankar, a psychiatrist in Chennai, practicing psychiatry for the past 30 years. And today we are going to talk about epilepsy. Epilepsy is known as a seizure, or in common it is fits, known as fits. It's a generalized neurological disorder in which the brain activity becomes abnormal. That's what we say. And normally we categorize this epilepsy into two types, like focal epilepsy or generalized epilepsy. The focal epilepsy will be losing consciousness and temporal lobe involvement will be there. And in generalized epilepsy, we'll see the flickering of hand, and commonly we see in the public. So what are we going to, there is no need of panicking with these kind of things. It affects both male and female and also children. It has no differences in the ages. It starts from the 0 age itself and depends upon the number of episodes. It may be in 24 hours. If it is repeating for more than 2 or 3 episodes, we have to look into it seriously. Otherwise, one episode and having some precipitating factors or situational fits, or there is a dependency fits like alcohol dependence or something like that, we can change the situation and then come back to normal and have a normal life. And this epilepsy can be dealt up easily and take a few minutes or few days of psychiatric drugs or neurological drugs, and we may discontinue the treatment in the earlier stage. But what happens to people who are getting repeatedly and getting in a very bad state? They have to go and have investigated by the neurologist or psychiatrist with EEG, electroencephalogram. You say we will be able to identify certain spikes in them, and it is in that aspect we have to take a long-term treatment with anti-seizure drugs, anti-epileptic drugs. Otherwise, so what is happening is in which there will be convulsions, and that will be appearing very fearful. That will only make a panicky attacks in general. So in psychiatric aspect of epilepsy, we have certain consequences for the diagnosis, and that consequences are unemployment in general, where these people are not able to get into employment continuously, or otherwise stigma. The people are not allowed, the families having the fits people, they are not allowed. Thank you so much. Take care. And this is what happens in epilepsy, and that has to be treated seriously if it is.